Today we've got a great webinar set up on optimizing clinical experience and how to utilize MyEvaluations to maximize that experience by enhancing the rotation, the level of engagement and feedback that residents are receiving. This webinar is a combination of both the clinical education component of just generally how to best manage clinical education, but also integrated along with it is how to utilize MyEvaluations to get to that destination. Consequently, our key topics for today are focused on four major areas that we're going to discuss. We'll probably take the full hour and a half to complete this webinar. This is really meant as a solid foundation for both program directors and program coordinators to understand how to improve that clinical experience from the resident's perspective and from your overall program perspective. So the four areas will be enhancing our clinical rotations. So I'll discuss specific strategies to make clinical rotations more dynamic and educational. We'll talk about utilizing MyEvaluation tools such as MyQuiz, learning assignments, EPA evaluations. I'll talk about also PIPs, performance improvement plans that go right along with that. So there'll be a few other things we'll talk about that to optimize that clinical experience and communicate back with the resident to help them improve, and how to improve that trainee and faculty engagement. For example, by integrating learning assignments and setting up preceptor relationships. And we'll also talk about feedback assessment tools and best practices for using the tools that we have already developed and made available to you in MyEvaluations, such as I'll discuss, for example, the DOCS, direct observation of clinical skills, and other tools. This webinar is not meant to be a MyEvaluations how-to. In this webinar, we will discuss the primary discussion here has to do with the actual optimizing the clinical experience. That's the main objective here. The secondary objective is going to be talking about the various MyEvaluation tools. So I want to make sure that you could distinguish those and not confuse the two components together. So this isn't just about, hey, what are the various MyEvaluation tools that you're going to use, but it's a combination of both that experience combined together with the services we offer. So in the first area, we're going to focus on enhancing clinical rotations. And clinical rotations are really the basis of all the medical education everyone is receiving. So we want to make sure that that experience is as dynamic and educational as possible. And it's the most critical component of developing competent physicians or clinicians by the time they're graduating. The three major components that we need to focus on to make clinical rotations more dynamic and educational is, first of all, incorporating a hands-on learning experience so they can reflect on the various learning experience they have. We have to structure rotations that have clear objectives and outcome-based learning. And we want to integrate the MyEvaluation services that we have available so we can give real-time clinical evaluation feedback back to the residents. So if you think about this as the basic structure is, we want you to have hands-on experience. We want you to know exactly what we expect you to learn and what the outcome is from this rotation. And we want to give you real-time feedback on how you're doing so you can improve yourself. This is what we would call an A+ clinical rotation experience. So taking these three components, we're going to break them down and look at each one of them one by one. So in terms of incorporating hands-on learning, we want to encourage direct involvement in patient care. Obviously, that's the structure of our rotations. The resident is directly involved in patient care. We want to also utilize sim labs or standardized patients to practice skills in a controlled environment. Generally, a lot of that is done in medical school, but depending on your residency program, for example, with the surgical programs, there's a lot of utilization of sim labs. And with the more clinically oriented programs where there is more of a human interaction verbally and physically rather than a surgical interaction, we are using standardized patients even in the first year leading into the second year of training. And we want to make sure that we rotate responsibilities among trainees so that they can have exposure to all the various clinical care experiences, so they're not isolated in just one type of experience most of the time. We typically see by the time residents are getting in their senior years, they have less responsibility exposure across various aspects, and they become a bit more focused on just key elements. So you want to make sure that you incorporate these three elements. In terms of setting clear objectives and outcomes, there are some specific tools we want to focus on. First is utilizing EPA-based evaluations so that you can communicate rotation goals directly within the assessment tool. So we have already organized specific webinars that we've discussed, and we've educated you and are available to you under my help on managing EPAs and how to design EPA-based evaluations. So if you access the menu option My Help, and under My Help you see Manage Milestones and EPAs, and there are existing webinars that discuss how to utilize EPA-based evaluations. And more specifically for some of your programs, currently general surgery, soon to come for orthopedic surgery, there are EPA-based evaluations that are now becoming the cornerstone of doing assessments. EPAs, which for those of you less familiar, stands for Entrustable Professional Activities. Rather than just simply asking questions about a resident's ability to, let's say, communicate clearly with patients and families, we focus more of an entrustment. Do I trust you to interact with patients and families? So a part of do I trust you to do that has to do with, do you have the knowledge to communicate properly? Do you have the communication skills to communicate properly? Do you have the professional aptitude to communicate properly? And do you know how to best utilize the system, that system-based practices, the hospital's infrastructure to coordinate patient care? So these various elements all tie together in a single entrustment, giving us these entrustable professional activities. The nice thing about entrustable professional activities, as we go through this webinar, I will show you specific examples of this idea of EPAs, is they can also live within the goals and objectives. So not only are you setting the goals and objectives based on those EPAs, but you're also simultaneously setting them up as the assessment tools. So as an example here, this is one type of evaluation which I'm encouraging you to utilize right now. This just has general questions on it, but this is an idea of an EPA-based evaluation where you have a specific entrustment, patient care and medical knowledge, but notice there are no scores here. This is just narrative feedback. And MyEvaluations is capable of using that narrative feedback in order to give scores. So our system will take the narrative, the comments, and convert them to scores for you. This is another example of an EPA-based evaluation that's based on scores. So notice there are only 6 questions in here. facilitating family meeting. And the faculty is going to give just one score. Are they beginner, advanced, competent, proficient, or expert? So if I expand on this, I'll see that this assessment for facilitating family meetings includes components about their knowledge, about practice-based learning, communication, professionalism, and system-based practices. So an entrustment is born with multiple characteristics built into it. And we want to make sure we can utilize those. And I'll show you how those entrustments are also put as part of the goals and objectives of a rotation. So we want to make sure that we also use case-based learning to align those clinical experiences with the educational goals. And this is where I'll talk about patient cases, submitting specific patient cases for review. Not just submitting all your patient cases, but for a resident to submit specific patient cases so they can be reviewed by a mentor or by specific faculty they're interacting with. So the second point was about setting clear objectives and having outcome-based learning, not just, hey, you got to do this rotation. At the end of it, we're going to assess you, but I really don't have a clear picture of what I'm going to get out of this rotation other than knowing it has a name, I'm familiar with the topic, but I don't know what I'm actually going to glean from this particular experience. The third component is in terms of incorporating all this, one idea here is how to use the system to enhance those rotations by providing continuous feedback. So this component of continuous feedback is a really very critical component of assessments, where we want faculty who are interacting with residents not just to give them an evaluation 2 months later. We all know how faculty don't complete evaluations in a timely manner, but instead we want to design evaluations that are very simple, like the one I had shown you a few minutes ago, that have just some very basic, simple questions on it that are purely narrative based. In this particular example, so that there are absolutely no scores they have to give. And in that case, there's two things. First of all, on the mobile app, your faculty can click on the microphone here. So I'm showing you a detailed image of that just for you to be familiar with. And they can actually click on the microphone within the comment field and simply dictate their narratives directly into the mobile app. So instead of them having to pick a score, and most of the time they end up picking similar scores all of the time, by writing narratives, it forces them to comment specifically on the interaction they had with the resident. There's also the ability for them to save and send feedback. So rather than submitting the evaluation at the end of the rotation, I'll show you later on how they have a save and send feedback button where they can send a partial feedback to the resident without actually submitting the evaluation. It's kind of like giving you a midterm feedback on how you're doing. Right along with utilizing tools within MyEvaluations, there's also tools for patient logging. So with patient logs and procedure logs, you don't have to submit patient logs for everything. The idea is to go through the patient log module to submit specific cases that we want to have assessed. So under submit new patient log, the resident can focus on submitting, and this is fully customizable, but submitting a specific case log that they had an experience with. And then under their list of patient logs, they're actually able to access them and over here, click Submit Review. Now, there is a separate webinar that we talk about how to set this up and how to customize these. Right now, our focus is really on clinical experience. So here, the clinical experience focus is, I had a patient experience. It had some unusual outcome that I wasn't expecting. So now I can go in and submit that case for review. So at the top it says, as a physician, you have the opportunity to evaluate, work up, and assess many medical problems. At times, what is seen in the early stages of illness may not present a clear indication of the eventual outcome. Consequently, it's important for a physician to obtain follow-up on patients seen in the earlier illness phases in order to gain feedback and to improve patient assessment, diagnostic workup, and disposition skills. Patient review and case discussions should be a regular activity for all physicians. So that particular case that I submitted, I can now say, I specifically want my preceptor or the program director to review this case with me. And the system asks the resident to describe the summary course after discharge. What was the follow-up method? What was the medical course or outcome? Did the medical course or outcome differ from what you anticipated? If yes, how did it differ? And what changes would you have made in your initial assessment and plan? So here the idea is not about submitting every single patient log, but cherry picking specific clinical experiences that helps me grow as a physician in training. And the same goes along with procedure logging, because procedure logging can also be tied with evaluations. Your individual procedure logs can have specific evaluations that are associated with them. So under the menu option procedures, I go to procedure and error tracking setup, modify list of procedures. I can actually have some of my procedures or all of my procedures have specific evaluation questions associated with them. So when I'm probably not the best example, somebody was messing around with that one. Let's go to another one. So when I submitted a procedure, my supervisor is also required to answer specific questions on that particular procedure. So this is an evaluation that's tied directly into procedures. So using patient logs in procedure logging, it can be submit everything that you do. We see that, for example, in family medicine, or it could be cherry pick specific experiences that you've had so we can give you more feedback. So the next phase is how to maximize that clinical experience, focusing on things such as my quiz, learning assignments, and EPA evaluations. The tools to use my quiz to improve trainee knowledge, learning assignments, to focus on specific topics that we want residents to learn on a rotation, EPA evaluations for real-time practical assessments, and we'll talk about trainee self-assessments, performance improvement plans, and then we'll touch on managed rotation requirements. So let's dig a little bit deeper into this. So specifically focusing on my quiz allows you to develop quizzes that are tied to competencies of each rotation. So you can use formative quizzes to reinforce that clinical knowledge, and you can also implement quizzes to prepare trainees for their specific clinical experiences. I'm going to pause for 1 second. So continuing, in terms of my quiz, we want to develop quizzes that are tied to the competencies for each rotation. We want to use formative quizzes. These are quizzes that are directly related to the topic to reinforce the clinical knowledge. And we want to implement quizzes that prepare the trainee for that particular rotation. We have case studies that we have published and are available on the MyEvaluations website that talk about the quiz module, and specifically how the quiz module, implementation of the quiz module for rotational based quizzes was able to improve board pass rates for programs to 100% just by implementing regular formative quizzes. Those quizzes can also be tied into our learning assignments. Learning assignments are specifically focused reading plans or case studies. These can have optionally quizzes that are embedded with them, so that we ask you to read about a particular experience and then take a specific quiz on it. The learning assignments help to reinforce the core competencies such as communication skills or system-based practices, so you can have specific learning assignments that are focused on those areas to help overall develop the resident over time. And the nice thing about utilizing the learning module, it helps you track those assignments completion and make sure that you're getting the desired outcome. That ties along with EPA-based evaluations, which I talked about as well, which allow for real-time assessments of clinical skills. All of these assessments are tied to core competencies for ACGME milestones. And the nice thing to always keep in mind with EPA evaluations is that they do provide specific, direct, actionable feedback to the resident that help them actually improve themselves. Like I had shown you in that example, instead of them being a more general item, they're much more specific on what we expect you to learn and what we expect you to be able to do. The last two parts are a two-phase. One is trainee self-assessments, and then in a minute we'll talk about performance improvement plans. So trainee self-assessments start first with milestone self-assessments. We've talked about this on multiple webinars where under the menu option evaluations, under your milestone setup page, so here I'm under the menu option evaluations, under manage milestone options, we're going to go to milestone setup. You want to make sure that within your program you have enabled user access to self-assessment and provisional CAW, and you want to enable reminder notifications and completion due dates so the resident can be informed to do those self-assessments. You want to make sure that you have EPA self-assessments. As an example, I mentioned that in general surgery, they have introduced a set of, in total, 51 EPAs. There are actually 18 EPAs that are broken down into subcomponents, but residents are expected, as part of the American Board of Surgery's requirements, the residents are directly expected to do self-assessments of the EPAs. So it's not just about getting a faculty to do an assessment on you, but it's about the resident doing the assessment as well. I want to use that as an example because you could build the same thing and implement the same thing within any one of your individual programs. So here as an example, I'm in the menu option evaluations, edit evaluations, and I'm looking at these various evaluation forms. So for example, I have an EPA evaluation for abdominal wall hernia evaluation and management. Now for general surgery, we have already done this, but I want to use this as just a simple illustration for you of how you can create a self-assessment evaluation. It doesn't have to be an EPA evaluation, but I'm using an EPA evaluation purely as an example. So on the far right-hand side, I'm going to click on duplicate. So this evaluation is already designed as an attending evaluation of a resident. Well, I also want the resident to do a self-assessment. Well, on the far right-hand side, I'm going to click on duplicate, and it's currently designed as an attending of resident evaluation. I want this to be designed as a resident of resident evaluation. And I'm going to name this EPA self abdominal wall hernia eval. That's what I'm going to call it. And I'm going to click copy. Now what the system will do, it will take that existing evaluation form, and it says template successfully copied. It will take that existing evaluation form that was designed as an attending evaluation of resident, and it will actually turn it into a self-assessment. So I didn't have to rebuild it. The system automatically copied it for me. Now I have a self-assessment. So here's the second part of it to make this really streamlined. Sometimes you'll have environments where a resident is being evaluated by one faculty, but they have a lot of clinical interaction with other faculties, like in a clinic setting or an ICU setting. So if you create evaluations for a clinic setting or an ICU setting where there's a lot of random interaction, and you tell the residents, we'd like you to do, let's say, this particular evaluation on yourself as a self-assessment. There's another tool in MyEvaluation called a dyad. Notice here at the end, the dyad function is available for me. When I click on dyad, it says, okay, the primary evaluation is that EPA self-evaluation. Once the resident does this evaluation, you could have the EPA abdominal wall hernia evaluation, the one by the faculty, automatically get assigned to the faculty that the resident selects. So the resident does a self-assessment, and because you've created a dyad relationship, the system will automatically tell the resident, hey, pick the name of the attending you worked with. So if this was a clinic where you don't have an opportunity to necessarily assign that clinic evaluation, now the system is telling the resident, just pick the name of the attending. That's all you have to do. And the system will then automatically assign that evaluation. So getting those self-evaluations or self-assessments done, I'm using EPAs here because I'm encouraging you to use EPAs, but you can do it with any type of evaluation. It doesn't have to be limited just to EPA-based evaluations. And the last component is the My Portfolio self-appraisals. And this is simply going under My Portfolio. All the trainees have access to it, and they go under the tab for appraisals and goals. This is where residents can actually put in personal learning objectives and goals, which will prompt them to put a statement in terms of a particular self-appraisal that they want to do, or they want to set a goal for themselves. There's also learning appraisals and plans. We have a separate webinar that focuses on all these self-appraisals and self-assessments as well. But the tool is already there for you to implement. As I mentioned, the second component of this is the performance improvement plans. These PIPs, performance improvement plans, are directly integrated as part of the CCC's review of the milestones. This allows the CCC to generate a performance improvement plan, and it also allows the program director to set additional performance improvement plans specifically for the resident. I encourage you to learn specifically about the PIPs. Under the menu option, My Help, we have a standalone document and webinar on managing performance improvement plans, steps of how to implement performance improvement plans. And there's a separate webinar, separate document for trainee instructions on how to do their self-assessments, performance reviews, PIPs, and appraisals. Don't look at PIPs as a negative a negative item. A PIP is actually a positive item that helps to actually guide the resident towards self-improvement. If you review the document we've provided on PIPs, it's not about punitive, it's not about documenting that you're not performing well. This is about providing the resident with specific guidance on how to improve a particular weakness, and to set up also a bilateral communication where the resident can also communicate back and forth. As an example, if we go to the menu option evaluations, we're going to go under the curricular assessment worksheet. which is the tool you're currently utilizing to review the milestones. We'll select a resident here just randomly to go through. And I'm going to scroll down to review this resident's performance. So here I'm looking at their individual sub-competency performance. I can see for patient evaluation and decision making what their score is. We may feel after clicking on details and looking at their assessments, we might feel that this person might need a performance improvement plan. So we simply click on performance improvement plan, which gives us a pop-up. In the pop-up, again, this is not teaching you how to set this up. I'm just going through it quickly here. There are different expected behaviors. If we think that there is a weakness, an area of deficiency, we simply select that, and it allows us to identify what the weakness is, identify what action plans they should take, set a date for reevaluation, and eventually determine whether they were able to do this successfully or not. So the idea of the performance improvement plan is when I initiate this, I write comments in here to give specific guidance to the resident. The resident receives an email and is able to provide back and forth discussion on this, and then we reevaluate the resident's performance at a later date. So this is one way of doing those performance improvement plans, and I encourage you to learn more about those in the specific webinar we have on performance improvement plans. So in terms of improving trainee and faculty engagement, we want to focus on specific techniques that improve that clinical experience. Those are active learning, regular feedback sessions, and faculty mentorships. So let's focus on those three elements. The first element is active learning for trainees. The idea here is to encourage your trainees to take an active role in patient care, not just a passive role where they just take care of what was assigned to them, but to be directly involved in the clinical decision-making under the supervision of the faculty. We want to make sure that we can facilitate peer-to-peer learning through case discussions or group problem solving. This comes up in things such as morning report, even M&M rounds are tied into this. So making sure that you have those scheduled through the conference module and they're properly being tracked is important. And we want to make sure that we involve trainees in interprofessional team meetings. This has to do with system-based practices so that residents are speaking with case managers, they're involved with nursing staff so they can get that cross-learning about what are the other things that are going on in terms of, okay, we have a discharge plan, but what are the particular challenges with this discharge plan or with the management of this patient's care? That second point has to do with regular feedback sessions. And here we want to make sure that there are regular feedback sessions that are scheduled for the trainee. This will tie into the faculty mentorship component that I'm going to talk about. But specifically here, I want to focus on mid-rotational feedback. So with mid-rotational feedback, we're usually thinking about, does that mean we want to do 2 sets of evaluations? No, it means very liberally just giving mid-rotational feedback. So here I'm logged into the system as a faculty. I'm going to go down here to complete evaluations. And I have these 3 evaluations to complete. I'm going to go to the first one over here as an example. And let's say that this is in the middle of the rotation. And I want to give some feedback to the resident that on these particular areas, they're doing how they're doing generally. And I'll write a comment, coming along well, need more surgical experience on this topic. And here at the bottom, it says, did you provide direct feedback on this evaluation? Well, I'm not ready to answer that yet. But what my real focus here with you is this button here that says save and send feedback. When I click this button, it actually sends an email to the resident allowing them to review this evaluation. That evaluation still stays in here. It's marked as saved. That's the little orange asterisk here. And it says that this evaluation has been successfully saved and a review notice has been sent to the evaluatee. So it allows the faculty to give an interim partial feedback to the resident without focusing on the end rotation assessment. So at the end of the rotation, I'll finalize everything, but I'm going to give you a mid-rotation feedback on how you're doing, so it's not a surprise to you. We want to make sure that we work with our faculty to learn how to give feedback that's constructive and it's focused on specific behaviors and outcomes that can be tangible to the resident. And as I mentioned before, we want to encourage self-assessments by the trainees, allowing them to reflect, which has to do with the entire concept of practice-based learning and improvement to improve their learning experiences. Now, this regular feedback session also ties into the next topic that has to do with faculty mentorship. It's very important with many programs that you offer that mentorship opportunity. Through MyEvaluations, from the menu option users, you have an option here for select preceptors. The nice thing about selecting preceptors, it allows you to, you can see here, you can create preceptor groups which have specific names. And what you're doing here is you're pairing specific preceptors with specific trainees, whether they're residents or they're students or they're fellows, it doesn't matter. The core idea here is to give those that specific access to the preceptors. that gives an opportunity for those preceptors to work directly with that resident to provide them more guidance beyond just that rotational evaluation. When you create a relationship between a preceptor and a resident, it gives them access to a lot of very important tools. For example, a preceptor will have access to the performance dashboard, not just on themselves, but the specific trainees that you have assigned them. So it allows a preceptor to select those trainees you've assigned them, and it actually allows them to go through and review their performance over time. I want to see, how did this resident do before? What were the comments written on them through my insights? How are they doing on their evaluation completion? How are they doing on their conference attendance? So it allows them to actually review specific performance markers on the resident. But in addition, under the menu option reports, preceptors also have access to an entire library of preceptor reports, allowing them to run reports on those specific trainees that have been assigned to them. So they can run a multitude of evaluation reports, clinical hour reports, conference tracking reports, procedure and patient log reports. So this gives them access to everything. They do not have access to the curricular assessment worksheet. That's restricted to the CCC and the program director, but it certainly does give them access to give more direct feedback on the resident's performance. The preceptors can also initiate performance improvement plans and learning plans for the residents. So this idea here is to encourage those mentors or preceptors not only on their rotations, but to help them set career goals and navigate some of the more complex cases where it's not just sufficient to work with the attending. It might be an outside attending who doesn't have all the desired time to work with the residents. So you want to make sure that you use MyEvaluations to encourage your faculty to do those reviews and provide the trainee feedback. As we focus on the faculty mentorship process, we want to also make sure that we can improve trainee and faculty engagement in general. So I'm repeating some of the themes that we talked about. Real-time assessments are important. You want to focus in your faculty development on the faculty providing actionable feedback, and you want to make sure that they are reviewing the assessment data in detail, as I showed you in those previous slides. So with real-time assessments, we're going to use MyEvaluations during clinical encounters to assess trainees in real time. And let's talk about some of those examples. So here we're going to go, not this profile, let's try a different profile. We're going to go to the menu option, My Help, as an example. I want to focus on some of the key elements that I want you to be familiar with and take some time to review. One specific area that focuses on clinical encounter assessments, not only are the patient logs that I mentioned at the onset, which are discussed here under Manage Patient Logs and Procedure Logs, but we can also focus on the specific requirements for direct observations of clinical skills. These are listed as docs. Docs were introduced by the ACGME several years ago. As you can see here, we have an educational document on docs. We also have a separate webinar on that. There's a learning document on longitudinal faculty development programs to promote effective observations and feedback. And there's a separate appendix that was provided by the ACGME that are available for you here as well. So opening this document, we've taken time to provide you with extensive details on how to use docs. Docs have to do with assessing that learner's clinical skills in specific clinical encounters. We'll take a look at what those encounters look like. But here under the docs module, under the procedure module, those docs are already set up. So if we look at that experience on the website, going to submit procedures. So what I'm doing here under procedures, I just typed in DO. You can type it all out, docs, and it brings up the various documents that have been set up for direct observation of clinical skills. So there are 7 direct observations that are set up here: bad news, clinical reasoning, counseling and shared decision-making, effective safe handoffs, history taking, informed decision-making, and physical examination. So when the resident selects a particular doc, they are selecting that doc. They are then identifying the clinical setting, was it inpatient or outpatient, identifying the name of the particular supervisor, and then what was the case complexity, low, medium, or high. And optionally, notice there's no red asterisks by patient information. They can put that patient information and submit that. So what the resident is doing, that resident is initiating a direct observation. They are going to a faculty and they're saying, I want a direct observation on breaking bad news, on physical examination. The faculty will in turn receive an assessment instruction so they can actually go into the system and provide direct feedback to the resident. So it becomes a bidirectional feedback opportunity where not only can the resident initiate this process, but the resident is also able to go in and seek direct feedback. So let's look at some of these direct observations and be more familiar with them. I'm going to go to the menu option, procedures. Under procedure and error tracking setup, we're going to go to modify list of procedures. So we can see our docs are listed here. If we click on view for these docs, this is you as an administrator, you can see that these docs have specific questions. What, if anything, did you observe the learner do well? What, if any, deficiencies or errors did the learner commit? Based on your observation in 1 to 2 sentences, how would you summarize the big picture of the learner's skills in this scenario? That is, how would you synthesize your observations into an overarching theme? And then last, based on the single observation, please provide an overall judgment on the learner. So you are not only getting very simple questions that they can answer by clicking on the microphone on the phone and answering these questions, and it will directly dictate it for them, but it's only one single numerical based score that's also being tracked in the system. So the other docs have a very similar format. I just wanted you to be familiar with this idea of how to use MyEvaluations for clinical encounters to assess trainees in real time. So I showed you an EPA assessment that was set up as a dyad, where the resident initiated the self-assessment that went to the faculty to then also assess them. Here, I showed you direct observations of clinical skills, where again, the resident is initiating the process. You're not asking the faculty. So it's very important that you are educating your residents, and similar documents are available under My Help for the residents when they log into the system. But you have to set specific requirements where you say, we want you to do at least 2 direct observations of clinical skills on each one of the 7 different topics that are available. So we want you to do Breaking Bad News at least twice, physical exam at least twice. So go through these exercises, and this can be done in the initial years of training. So these are examples of these short forms that allow a clinical supervisor to provide direct feedback to the resident on their performance and how we can use the mobile app to facilitate that feedback without delay until the end of rotation, where essentially they're just telling you, hey, how did you do? Focusing on not only real-time assessments, but we want to make sure they're actionable feedback. So it's very important as part of your faculty development that your faculty focuses on specific observable behaviors rather than general comments. Far too many programs do evaluations that ask very general questions that don't actually help a resident develop their skills. So be very specific, make sure you're getting observable feedback. You want to provide a balanced assessment where you're asking about strengths and areas for improvement. As you saw in the doc, what did they do well? What didn't they do so well either? Where can we help them? And you want to encourage faculty to provide that feedback as immediate as possible so it can be actionable. I keep repeating the same theme. We can't expect the resident to improve. We can't improve that clinical outcome at the end in terms of their clinical experience if we're not giving them that immediate feedback so they can improve. Telling them about how they did in a very generic way 2 weeks, 2 months after a rotation is over will not help them directly improve. And lastly, we want to make sure that we review the assessment data regularly. So I showed you the performance dashboard. I showed you My Insights. These are both available to you from the menu option home. So the performance dashboard is, again, we have a separate webinar that we've discussed the performance dashboard in extensive detail. So here from the main home screen, if we go to My Help, right at the very top, we have a recent webinar on understanding and leveraging data analytics and data-driven decision-making. This webinar was an hour-long webinar that talked about the performance dashboard in great detail. I encourage you to watch that webinar to learn about this performance dashboard and how you're able to select your trainees, how you can look at current years and previous years. We talk about My Insights, where this is an AI-generated feedback to the resident based on a summary review of all the comments that have been written on the resident in all the various assessments. So notice, even in My Insights, we focus on what are your strengths, what are your areas for improvement, and can we give you an overall picture? And in the next iteration of My Insights that will be released November, the first week of November, that means these narratives are released every 6 months because it's summative. It looks at all the comments that were written on the resident over the course of 6 months. The next version of My Insights this November of 2024 also includes direct actionable feedback, including short-term and long-term goals for them to set. And as I scroll through, I can see their competencies, and then I can review individual sub-competencies listed under each one of the competencies. So I can see their competency versus benchmark performance, and here I can see individual sub-competency performance with all the data broken down for me over time. And there are 13 total benchmarks that I can review. So you want to make sure on a preceptor basis, on a program director basis, and even on a CCC basis, that this information is regularly reviewed so that you can see trends in the trainees' performance and indicate any areas where they need to do remediation. And even when you look at the performance dashboard, you'll see at the very top of the performance dashboard, there is add a learning appraisal and plan. And in the next couple of months, this will be expanded to provide 3 areas of assessments and plans that you can set administratively and as a mentor directly through the performance dashboard. So you want to make sure that you use this data to tailor individual learning plans and those PIPs. Again, please take some time to review the PIP document. A lot of people misunderstand PIPs as being punitive. They are meant to actually help the resident improve over time. And then the last topic is for looking at your faculty evaluations to make sure that the faculty are scoring the evaluations in a meaningful way. And we do that directly through the faculty scoring profile report. So if you go to your menu option reports, yeah, waiting to go to the menu option reports. Seems like I'm having a little challenge here. Sorry, give me 1 second. It looks like I lost my login session here. Okay. Under the menu option reports, there's resident reports, and then below that we have our attending reports. There's the attending scoring profile report. This report actually allows me to look at a 1 year, 2 year date range, and I can pick 1 or more faculty, and I can pick specific evaluations. I'm reluctant to want to select specific evaluations from in here right now, so I'm just going to pick a whole lot of them. And what this report will do, it will look at the scoring trends of faculty. So looking at the cardiology evaluation of resident, how did Dr. Adler score residents? How did Dr. Adhav, Dr. Soria rate the residents? So I'm able to go through and look at their scoring profile tendency. And we want to make sure we review those on an annual basis to see how our faculty are scoring evaluations and if they need specific assistance on that. So as the last component over here, you want to make sure that you incorporate best practices for feedback and assessments. The key things to keep in mind here are timely feedback. So we want to use the mobile app to provide immediate actionable feedback during the clinical rotation. Use that option to save and send feedback. We want to make sure that we are doing longitudinal assessments, using the performance dashboard and MyInsights to review trends over time. We want to use procedure logging and patient logging in order to give direct feedback on clinical experiences so we can improve those clinical experiences, and that ties into the direct observations of clinical skills. And we also want you to focus on those narrative evaluations that I showed you. And if any of you don't already have that clinical evaluation version 2 and 3 in your program, because we've made those available to you, you can shoot me an email and I'm happy to provide that to you. But those narrative-based evaluations are going to be very important, because come this November, we are also introducing a new narrative predictive value where our system will utilize just the narratives from the evaluations to provide you with guidance on how the resident is doing in terms of the milestones. So tying all these together becomes a very important part of the feedback and assessment that you're doing with residents to optimize their clinical experience. Let's focus on any questions now. I don't see any written questions. I've gone ahead and unmuted everyone in case you have any questions.